Our study is the beneficial effects of hydrogen-rich saline irrigation on chronic rhinitis, a randomized double-blind clinical trial. Our research team is composed with Shaoqing Yu and Professor Zishen Ai and co-corresponding authors. Ling Jin and Kai Fan are co-first authors. This is the project quality assurance. This is the ethical approval and the clinical trial registration. Chronic rhinitis is a common chronic inflammation of the nasal mucosa. This seriously affects patients and carries a huge economic burden. Nasal irrigation is simple physiotherapy. Nasal saline irrigation has been demonstrated to be an effective treatment for chronic rhinitis. Immune dysfunction is not alleviated by irrigation. Hence, the beneficial effects usually disappear after 1 hour. Hence, lavage containing a solution of anti-inflammatory agents may have better therapy effects. Previous studies have demonstrated that hydrogen dissolved in saline to generate a hydrogen-rich saline solution was effective in relieving allergic rhinitis symptoms and reducing inflammatory mediators. In this study, we investigated the beneficial effects of hydrogen-rich saline irrigation as an anti-inflammatory irrigation therapy for chronic rhinitis, including allergic rhinitis and non-allergic rhinitis, and compared its effectiveness of saline irrigation. 120 patients with chronic rhinitis were randomly divided into 2 groups. Patients irrigated with hydrogen-rich saline group and the control group irrigated with normal saline. A randomized double-blind control study was performed. The main observation index in this study was the total score of nasal symptoms. In addition, eosinophilic protein of the nasal secretions, nasal nitric oxide levels, and the levels of regulatory T cells Treg and the regulatory B cells Breg were also compared between the 2 groups. Furthermore, patients with allergic rhinitis and non-allergic rhinitis were also evaluated by serum-specific IgE positivity. This is the patient information. This is the informed consent form. This is the standardized method of nasal irrigation. This is distribution and recovery of saline water. After treatment, the total score of nasal symptoms and the nasal eosinophilic protein in the 2 groups decreased significantly, p less than 0.05, with patients in the hydrogen-rich saline group showing significantly lower levels compared to the nasal saline group, p less than 0.05. There were no obvious adverse events observed in patients during the entire treatment period. Compared to saline irrigation, hydrogen-rich saline nasal irrigation was found to improve chronic rhinitis chronic symptoms, especially in patients with allergic rhinitis. Hydrogen-rich saline could effectively be used for clinical treatment of patients with chronic rhinitis. Thank you.